Hello everyone, welcome back to Pathomad. Today let us study about benign prostatic hyperplasia. So benign prostatic hyperplasia, as the name suggests, it is a benign condition and it is characterized by hyperplastic gland. Hyperplasia means this increase in cell count of what both the stromal and glandular component, which I'll discuss in detail. So let us have a brief anatomical discussion. This is the urinary bladder coming down as urethra. Around the urethra is this globular structure called prostate. So prostate is present around the urethra. So this prostate, it has certain zones immediately around the urethra. Periurethral zone is this transition zone. Transition zone is here important in BPH. BPH begins in this transition zone, which is immediately around the urethra. Periurethral zone is the transition zone where the BPH occurs. The other zones be thin anterior zone. Around the ejaculatory duct is this central zone, and peripherally, the outermost is the peripheral zone. In this BPH, the transition zone is responsible where the hyperplasia begins. So prostate gland is a 20 grams, it is a 20 grams organ. Usually, normally it is 20 grams and it gives response to androgens like dihydrotestosterone. In the body, the testosterone gets converted to dihydrotestosterone with the help of an enzyme called 5-alpha reductase. The 5-alpha reductase enzyme, it is of two types, 1 and 2. 1 is synthesized by the liver, whereas 2 is synthesized by the prostate. So it is believed that with increasing age, there is increase in type 2 5-alpha reductase. When type 2 5-alpha reductase increases, this will cause increased conversion of testosterone to dihydrotestosterone. This dihydrotestosterone DHT it acts upon the prostate gland and brings about hyperplasia. This is the pathogenesis of benign prostatic hyperplasia. This is the histopathology part where we can see the low power view of the prostate gland. Prostate gland contains, it is a gland, means it has glandular component. This open spaces, the open structures with a lumen and certain lining with space with central lumen and a lining are the glands. So it has a gland component number one. There are intervening structures, the intervening tissue. This is called the stroma. So it is composed of glands and stroma. Most of the organs which are responsive to the hormones like ovary, breast, endometrium, cervix, etc., they contain both gland and stroma. Gland and stroma presence is common to these organs which are responsive to hormones. But in prostate, the stroma is very special because the stroma is fibromuscular. It is fibromuscular because the prostate has to give like a good amount of contractions to eject out its prostatic secretions into the semen. It is therefore the stroma is highly fibromuscular. It has both fibrous tissue and the muscular tissue in the presence of smooth muscle cells. In this low power view, we can see there are certain nodules. This is one nodule, this is other nodule, this is again other nodule. These nodules are separated by this bands. These are nothing but the fibromuscular stromal bands separating these nodules. In this low power view, we can visualize this much. And within each nodule, this is a glandular structure containing lumen, central lumen, and this epithelial lining around the gland. Certain glands, these are cystically dilated glands. These are cystically dilated glands. Few glands, they're normal, but they show epithelia, this epithelial proliferation into the lumen. Here you can see this epithelial proliferation from the lining, there's certain things projecting into the lumen. So here also there's stromal hyperplasia, this increased pinkishness here. This is the stromal hyperplasia. Therefore, BPH is characterized by both glandular and the stromal hyperplasia in varying proportions. Coming to the hypover here you can see this one gland, focus on this one gland. So, Here, focus on one gland. This is the outermost layer. The gland, this lining of the gland, it has two layers. It is a double layered epithelium. The outermost layer, this is the outermost layer, contains elongated or the flattened cells. These are the flat nuclei of the flattened cells. These are nothing but the basal cells. So the outermost lining is the basal cells. Here also the outermost lining is basal cells, flattened nuclei. You can see the flattened nuclei. These are the basal cells. The outermost, this outermost layer is the basal cells. And the inner lining, these are the tall columnar cells with basally located nuclei. Towards the base located is the nuclei, and these cells are tall and columnar cells, and they have abundant cytoplasm compared to the basal cells naturally. And the cytoplasm is like a pale compared to the basal cells. They are pale eosinophilic, abundant cytoplasm, and basally located nuclei. The presence of this basal layer is very important to confirm that it is a benign condition. So basal cells are present means it is a benign condition. If these basal cells are lost, it indicates this progressing or it has already progressed to carcinoma. So these columnar cells are called luminal cells because they are facing the lumen. These luminal cells, they secrete, these are responsible for this prostatic secretions. And this laminated structures that you see, these are the prostatic secretions. With age, they have formed this laminated concrete structures. They are called corpora amylacia. Corpora amylacia are nothing but prostatic secretions only. Also, this intervening stroma, you can see they're like spindle-shaped nuclei also can be seen. Spindle-shaped nuclei. Smooth muscle cells also seen. The smooth muscle cells can also be seen. So the stroma is fibrous and muscular, both fibrous and muscular. In this view, in this gland, you can see there's like hyperplasia. The number of columnar cells has increased and it has projecting into the lumen. So all the lumen is almost filled up with this columnar cells because they have gone hyperplastic. The cell growth has increased. They have grown so much that they folded upon themselves and grown inside the lumen. So there are papillary projections of this epithelial lining also. This is image taken from the TERP chips, that is transurethral resection of prostate. This is a specimen of TERP chips. So you can see these bands. These are the bands of prostate gland. You can see this is the fibromuscular stroma. Like the dense violet is the muscle component, the light violet is the fibrous component. Presence of both fibrous and muscular stroma. There are glands lined by this epithelium, double layered epithelium, which cannot be like highlight appreciated well on this low power view. There are cystic dilatations of the glands. Few of the glands, the epithelium has grown inwards like papillary projections. They have papillary projections, like these papillary projections. These are the papillary projections. So papillary enfoldings of the epithelium indicates it is hyperplastic. This is stromal hyperplasia as well. The stromal component has increased. Few of the glands are cystically dilated. All this favor benign prostate hyperplasia. This is the hyper view. You can see this concrete prostatic secretions. This is the fibromuscular stroma. This dense violet is the fibromuscular stroma. The glands have become hyperplastic, the epithelium has become hyperplastic, and they have grown upon itself and enfolded into the lumen like finger-like projections. Finger-like projections are called papilla. So papillary enfoldings of this epithelium into the lumen along with stromal hyperplasia. This is again cystic dilatation of the gland. Epithelium is still present. Here also the epithelium is a hyperplastic and grown upon itself. Grown upon itself. This is the fibromuscular stroma. So this is the IHC staining for P63. P63 confirms it stains the basal cells. So the brown stain is the basal layer. Anything, any IHC marker, it stains only, it gives only either brown or blue. So brown means positive, blue means negative. So here the basal epithelium, the basal cells, they have taken up the IHC stain and they appear brown. There's a continuous brown layer, intact brown layer, confirming the presence of intact basal epithelium. So it indicates it is a benign condition. See here, the columnar cells have not taken up the P63 marker. So therefore it is blue color. It is negative. Only the basal layer is marked by P63. Other marker for basal cells is high molecular weight cytokeratin. This is the other marker for basal staining. So base presence of basal layer indicates it is a benign condition. And these features of this papillary enfolding of the double layered epithelium into the lumen with this fibromuscular stromal hyperplasia, all this favor the diagnosis of benign prostatic hyperplasia. If you like this video, please like, share and subscribe. Please. Thank you everyone.